So question is, what is a meniscus and why do we have it? What does it do? So a meniscus is made of cartilage. Cartilage is one of our body tissues that we have kind of dispersed throughout the body in certain areas. There's three types of cartilage. The cartilage is the most common. It's called hyaline cartilage. That's the cartilage that caps all of our bony ends in our joints. So when our joints kind of rub together, that cartilage kind of supports it and gives nutrition to the joint. That's the cartilage that we talk about when we have arthritis. It's kind of the wearing away or degenerative changes in hyaline cartilage. The other two types of cartilage are elastic cartilage. So for example, in your nose, you have the wiggly part of your nose is made of elastic cartilage. And then finally we have this cartilage called fibrocartilage. Fibrocartilage sounds sturdier, it sounds fibrous, and that's exactly what it is. So fibrocartilage is found in our knee. We know that as the meniscus of our knee. It's also found in between the discs of our spine and in our pelvis in a certain spot. So when it comes to the meniscus, we still inside of our knee joint have that capped bone and cartilage, so that hyaline cartilage that kind of goes on the joint surface like that. But not every joint has fibrocartilage. The knee is one of those kind of specialized joints that does, because of the weight bearing that has to go through the knee and the loads that have to be absorbed. And that's exactly why we have a meniscus. So a meniscus is kind of a C-shaped curve.
Have you been easing a little bit more into putting some weight into that foot as you walk?
Yeah. Okay. Thank you.
So all that's coming back.
Yep, today's probably the first day
that sits in between those two bones and the femur and the tibia. And as we weight bear through our femur and our tibia, and we bend and straighten, it adds an extra layer of support, absorption of our weight, and the absorption of the forces that have to go through our knee. What the menisci don't do very well is it's not very good at moving and being flexible. And so if we're putting our joint in a position that overly stretches or compromises that tissue, it's possible that the meniscus itself, instead of being flexible and moving, can actually rip or tear. And so if you have a meniscus tear, that's probably what's happened. Good news about that though is there's been a lot of research lately that indicates if you do have a meniscus tear, that's not necessarily a reason to go jump and have surgery right away. Oftentimes that can be rehabbed in physical therapy successfully. So that's something to consider. But that's meniscus, and that's why we have it.